Thyroid inhibitors. There are four major categories of thyroid inhibitors. First, which inhibit thyroid hormone synthesis, then the ones that inhibit iodide trapping, inhibit hormone release, and the fourth category will destroy thyroid tissues. So, four categories of thyroid inhibitors. First, which inhibit thyroid hormone synthesis, second, which inhibit iodide trapping, third, which will inhibit the release of the hormone, and fourth, which destroy thyroid tissue. So the drugs that inhibit thyroid hormone synthesis are known as anti-thyroid drugs like propylthiouracil, methimazole, and carbimazole. So anti-thyroid drugs like propylthiouracil, carbimazole, and methimazole, they inhibit the hormone synthesis. Then ionic inhibitors like thiocyanate, perchlorates, and nitrates, they inhibit iodide trapping. Ionic inhibitors like thiocyanate, perchlorates, nitrate, they inhibit iodide trapping. And the drugs that inhibit the release of the hormone are iodine, iodides of sodium and potassium, and organic iodide. Iodine, iodides of sodium and potassium, and organic iodide, they inhibit the release of the hormone. Then radioactive iodine, that is 131 iodine, it destroys thyroid tissue. So four categories of thyroid inhibitors. First, the ones that inhibit hormone synthesis, anti-thyroid drugs like propylthiouracil, carbimazole, methimazole. Ionic inhibitors, they inhibit iodide trapping like thiocyanate, perchlorate, nitrate. And then the ones that inhibit hormone release are iodine, iodides of sodium and potassium, and organic iodide. Then radioactive iodine, 131 iodine, it will destroy the thyroid tissue. Then thyroid hormone, it has two forms. One is thyroxine, that is T4, and triiodothyroxine, that is T3 or leothyronin. ठीक है, T4 का synthetic form is known as levothyroxine and T3 is known as leothyronin. ठीक है, so these are the forms of thyroid hormone: thyroxine, T4, triiodothyronin, that is T3 or leothyronin. And then thyroid inhibitors are of four categories: the one that inhibit the synthesis, inhibit the iodide trapping, inhibit release, and then the ones that destroy the thyroid follicles.